to turn the podium over to Dr. Jim Madara, Executive Vice President of our parent organization, the AMA.
Well, first and foremost, let me give my congratulations to the award recipients. You personify what it means to be a physician, and you remind all of us of why we were compelled to go into this field. I also want to thank the AMA Foundation. You continue to support many good works on behalf of physicians and patients, and I want to offer my congratulations in particular for this night. You're now in double digits. This is the 10th anniversary of this event. Congratulations. Now, Dr. Chu has already highlighted some of the important contributions that the Foundation is making and has made to advance public health and medical scholarship. For 63 years, the Foundation has helped patients live healthier lives through its generous support of physician-directed initiatives. In addition, as alluded to by Dr. Chu, the Foundation's support for the next generation of physicians has been profound. It has been $60 million profound in scholarships that provide tremendous opportunity. And as was alluded to, debt is a big problem for our medical students. In 2012, the median public debt is $160,000. The median private debt is $190,000 for students graduating with debt, and 86% of our students graduate with debt. Now, if we take the median for a public school of $160,000, and we ask what that means to the individual will go through the 4 years of medical school, say a 4-year residency, and then begin to pay back that debt. The average payback on that median debt of $160,000 is $321,000. And that $321,000 payout begins roughly at age 30. So that shows you the difficult position that our students are in, and it shows you the power of what the AMA Foundation has approached and done in the last many years. So as we look ahead, I also want to thank the Foundation for its support as the AMA rolls out our new long-term 5-year rolling strategic plan. As many of you know, this plan is highly ambitious, and having the support of groups like the Foundation really means a lot. We're really happy to have the Foundation as one of our first partners going forward. Now, let me just familiarize you with our plan. If you haven't heard about it already, it has 3 elements in the mission area. The first is improving outcomes for patients. We have worked with many large systems, payers, toward this end. I think 6 to 8 weeks from now, you'll hear a major a statement of progress in this area. The second is accelerating change in medical education. So the structure in medical education that's been in place for now more than half a century can be updated to what physicians need as they exit training and go into practice. Now, the RFP for this just went out a few weeks ago, after January 1st. When I flew down here to D.C. For this meeting, we had already received letters of intent from 83 medical schools of the 130 in the United States. While that was 3 days ago, I learned today that we finally reached the century mark. We have letters from 100 schools. In enhancing physician satisfaction, practice sustainability, our third goal, we now have pilots going on in 6 states. We want to enhance the environment that our physicians practice in to make it a satisfying experience. So obviously, these goals require many groups to work together, and this is why we're so delighted with the Foundation's interest in our strategic plan. And we think that this work is absolutely essential if we're going to shape a better healthcare future for patients, physicians, and the country as a whole. Given the important intersections that our plan shares with the Foundation's work, I would have to say particularly in the area of health outcomes and medical education, we have lots of opportunity to work together. But tonight, we're not here to discuss the challenging work, but here to celebrate the exceptional work that has already been accomplished. Now, you will also recognize that tonight we have awards for leadership of students and residents, but we also have career awards for physicians that have had just profound impacts on healthcare. And while we hear at this meeting that there are many challenges, this spectrum of young to senior that we see here tonight and celebrate reminded me of a quote from Churchill, something that Churchill spoke during the dark days of the firebombing of London in the Second World War. And the quote is, "The future is unknowable, but the past should give us hope." And so students that are here today and young physicians that are being celebrated for their leadership and recognize that there are challenges in the future can look to the senior group awarded tonight for their outstanding work and fulfilling careers and impact on health and recognize that the past should give us hope. Few physicians expressed this hope for being a great physician any more than William Osler, Canadian, who of course was a senior figure in American medicine at Johns Hopkins. Osler said that a good physician treats disease. The great physician treats the patient that has a disease. I must say that I witnessed this recently. My son, diagnosed with Crohn's, was in to see his physician, who he thinks is fabulous. And the physician began the conversation not by asking questions of digestive function, but by saying, Max, how's your life? What are things you used to do that you can't do? What can we approach in this way? That was a great physician. The physicians we honor tonight understand this and understand that medicine is first and foremost a uniquely human endeavor, an endeavor that requires not only having compassion to care about the needs of fellow citizens, but also the human conviction and courage to step forward and alleviate pain and suffering when it is seen. Those we honor tonight possess compassion, conviction, courage, and I have to say, possess these three attributes in abundance. They epitomize the humanity that is the heart and soul of medicine and what it means to be a physician. Although their individual stories, as you will see, are unique, all share a common storyline of not letting challenges or adversity get in the way of what needs to be done. The resourcefulness and perseverance these physicians have exhibited during their work should serve as an inspiration to all of us. So this evening, we celebrate great doctors. We honor tonight's Excellence in Medicine Award recipients and celebrate the accomplishment of medical students who are following so diligently in their path and in whose path they find hope. I think the AMA Foundation President, Dr. Chu, may have captured this in his address tonight of embodying the true spirit of the medical profession. So Doctors Jacobson, Mandel, Morsh, Raju, and Worship, on behalf of the AMA, congratulations. You make us all proud to be physicians and proud to be physicians in the reflection of your accomplishments, and those same accomplishments provide the light of hope for the path for the young physicians of today. Thank you very much.